CanSAGE meeting in Montreal, and I'm here with my colleague Catherine Allaire. Catherine, I'd like to speak to you now specifically about endometriosis-associated pelvic pain. Obviously, chronic pain is a big topic, but let's just focus on those patients where we feel endometriosis plays a role. When you see a patient like that, you've made the diagnosis, what are some of the principles that we should teach our colleagues in how we manage those patients?
I think the most important principle is to treat the symptoms, to have a symptom-tailored approach and to have a discussion with the patient about what she's trying to achieve in terms of what her goals are. Because if her main symptom is, for example, intercourse pain, then the treatment might be different than if her main symptom is infertility, for example. Now we're talking about pain, so of course in the context of pain even there are some variabilities in how they present, and certainly there's a wide range of options. We do have medical options that are quite effective in many patients, and also surgical options as well. And in some patients, neither one of those options seems to help, or they have recurrence of symptoms. And in that case, we have to start looking a little deeper into what else is going on.
Yeah, so I think it's not just one approach for everybody. It depends on if they want to get pregnant or not, what's worked before and not.
We have to take a long-term plan because unfortunately endometriosis is a chronic illness. And so if you're taking a long-term plan, surgery really tends to be reserved for a one-time approach where you kind of do it at the right time for the right indication and with the right surgeon. So you don't want to have recurrent surgeries for endometriosis because the outcomes are probably not as good as just maintaining a good symptom control with medications and going to surgery for that time when it's necessary.
So in terms of surgical experience or ability to manage some of these problems, there's different forms of endometriosis as well, right? In some of the more difficult ones, do you often work with other specialists or colleagues too?
So you're referring to what we call deep infiltrating or deep endometriosis, which is the more advanced stages of endometriosis, which certainly can involve other organ systems such as bowel and urogenital system, bladder, ureters. And in that case, it's very important, first of all, to screen appropriately and diagnose these issues prior to going to surgery so that you can have the proper team present at surgery, including bowel surgeons or urologists if necessary. Yes, we do that.
Yeah, so sometimes it can be straightforward, sometimes more complicated as well. So not just one approach, look at a full combination approach to these patients, right?
Correct.
Thank you very much for being with us.
You're welcome.